Hi, my name is Juan Dorste. In this video, I'm going to go ahead and talk about and demonstrate how to handle a patient experiencing chest pain at your primary care clinic, and the steps that you should do once the situation is going on. So I'm going to go ahead and present first that I'm going to go ahead and welcome the patient in. Her name is Cecilia. She's here for an IUD because she no longer wants kids. So I'm going to go ahead and verify her information, then take her up to the office, have her sit down, and we'll proceed from there. Hello, Cecilia. Hi, welcome. Okay, I'm gonna need you to verify me some information first. Okay, good. And you're here for an appointment, right? Okay, perfect. So we're gonna go ahead and step into the office. Okay, she's here at the office. Take a seat. Okay. What's wrong? Are you okay? Or you're experiencing chest pain? On which side of your chest? Your left side. Okay. Okay, and you're having difficulty breathing. Okay. Okay. So, in this situation, place the money here. So in that situation, you would go ahead and ask the patient where is she experiencing any pain, and from there you will go ahead and ask her where the pain is coming from. So from her chest, she said her left side, and the pain is radiating from her left into her left arm, and it feels like she has a lot of pressure in her chest. Also, she is a little panicky, but she has no tingling in her fingers or around her mouth. She starts to feel nauseated, and she develops mild shortness of breath after about 10 minutes of chest pain. She gets slightly dizzy after a few minutes, and so I will go ahead and ask her, from a scale of 1 to 10, how bad is the pain that you're in right now? She says 5. Okay, that's okay. It's better than 10. And now we will go ahead and ask her also, are you taking any medications? She says yes. She's taking 2 medications. She's taking Lipitor, which is for her cholesterol medication, and she's taking Atenolol, sorry. That is her blood pressure medication. However, she ran out a couple days ago, so she hasn't been taking those medications. That medication for her blood pressure. So I go ahead and ask her, did you eat or drink anything today that you think may have affected you today? She says yes. She drank 2 cups of coffee. So I tell myself, okay, she didn't take her blood pressure medication. She hasn't been taking it the past 2 days, but she drank 2 cups of coffee this morning. So that may have raised up her blood pressure, and the fact that she took the bus here to the clinic, which is the most exercise she has done the past couple of months. Okay, so that just tells me that maybe the coffee was the reason why she's having chest pain right now, which is raising her blood pressure. So I go ahead and call the primary physician for the clinic, and I call 911. The reason why I'm calling 911 is because, again, you are at a primary care clinic, not a hospital, nor a primary care clinic that focuses on the chest or her heart. So I go ahead and call 911, and once 911 has been called, I will go ahead and place the patient on a semi-pouch position because she is having shortness of breath, so she is having a difficult time breathing. And from there, I will go ahead and check her vitals twice. So I check her vitals, and her first trial of the vitals, her pulse is at a 150. Her blood pressure is at a 145 over 85. Her temperature is at 98.6. And so then I go ahead and decide to go ahead and check her vitals 5 minutes later. I go ahead and check her pulse again. It's at a 160. Her blood pressure is at a 150 over 95. And yes, so once those vitals have been, once that information has been gathered, I will go ahead and write that down on the piece of paper so I can go ahead and give it to the EMS team once they arrive. And also, it's very important to make sure that you don't give the patient any water or food because you don't want to worsen the situation. So just best to just be alongside the patient's side to make sure that her chest does not feel any worse, that she is staying stable until the EMS people have arrived, and that's basically all that I will do in that situation. All right, and this concludes the video. Thank you.